Good day. My name is Maria Teixeira at UFES, and it's an honor and a pleasure to be here representing my co-workers to present an arm of an intensive and an extensive work we are developing nowadays that is called OntoWoH network. OntoWoH, this arm, is a reference ontology focusing on women's health. And as this is a huge subject, we started with the climacteric and menopause stage. So we started at the end. I will be following today the typical outline. And first things first, our final goal is to build a healthcare information system. And to do it based on quality criteria, we decided to start with a conceptual model. The purpose of this information system will be to support decision-making healthcare system. That is a common goal. And as we have common goals, we have some common challenges independent of the domain, as for example, the one we have here, knowledge, understanding, and sharing, and a technical one, integration between different databases. We believe that ontologies is a solution to solve such challenge, so we build a conceptual model based on an ontology. It can solve, for example, a domain problem to establish a terminology, and also some technical stuff as to achieve some quality criteria of integration of knowledge databases. Well, as just formalizing our goal to represent the complex and extent domain of women's health, focusing on climacteric and menopause aspects in its first version. The purpose of this goal is to help in communication and understand of agents. And these agents can be human and, of course, artificial ones. And to facilitate the achievement of this goal, we need to understand, to initiate studying the domain, and we decided to study this guided by woman's life. A woman's life has some adopted terminology, has some involved process, and it's interesting to understand the kind of problems that direct the woman to, for example, some healthcare service. The woman has several phases along during her life cycle. Some phases are common to any person, for example, childhood, adolescence, adulthood, and elderly age. But some of the some phases and some aspects are particular to women. For example, the menstrual cycle, childbirth, pregnancy, and of course, the climacteric stage. All of these stages has its own terminology, as own characteristics, process, and they are connected to each other. Considering the size of this complete domain, we decide to start with basically two phases, the climacteric and menopause stage. And to work with it, it's necessary to understand the previous stage, the reproductive stage, mainly the menstrual cycle that is directly connected to why menopause occurs. We focus nowadays in the terminology, and we select the straw terminology that is considered the gold standard in this field, and the climacteric syndrome, basically the symptomatology and the treatment of some common health products. And why we decided to select this stage, the climacteric one? I heard a few days ago a very interesting phrase that the climacteric is the end of the reproductive period of a woman, but not of her productivity. And considering this, and that the women are the majority of the Brazilian population and the main users of our SUS, the Brazilian public healthcare system, and that we are facing, what is a good deal, an increase on our life expectancy, it makes sense to understand by this aging stage. And of course, I have personal motivation. I am a woman. My colleagues, the authors of this work, are also women. So we hope to face this phase at some point of our life, because the other possibility not facing it is because we will be dead. So I prefer to leave this stage. We are seeing a lot of evolution in understanding this domain, but we did not achieve yet the ideal point. Of course, now we evolved from the point that the only role of the woman is taking care of the family. Now we are taking care of the family, but we are also professional. But as we are not in the ideal point yet, the discussion about aging is a kind of problematic. We prefer to avoid it, not to think that it's natural, the aging phase. And here we are talking about women, because we are women, so we were tendencies in our choice. But male situation is similar. So at some point, you need to understand not only women aging, but also men aging. Each one has its own particularities, and the healthcare services should deal better with this point of our life. Sorry, I don't know what happened. It's not working. No, sorry. Try to put this better, and I made a mess. Would you like to start? I think. Yeah. Well, it is necessary to model the domain. It was necessary to deepen a bit more on it. We decided to start with the biological aspect of aging. To understand the climacteric stage, it is necessary to understand the previous stage. There is the reproductive one, mainly the menstrual cycle. The menstrual cycle is a process that involves organs, glands, hormones, follicles. So it's a very complex process. Menopause, of course, because over time there is a decrease in the number of follicles produced by a woman body. There is also a progressive drop in the number of hormones that is involved in this process. And because of this reducing situation, the organs of ovaries begin to respond less to the stimulation of the hormone that is necessary to do the menstruation cycle. At the beginning, we notice that the menstruation turns irregular, then the ovaries stop producing the ovules, and the menstruation turns irregular till it stops completely. The point here is that the climacteric is in a common sense, popular sense, dealt as a pathological process. To say that you are in the climacteric stage, you are facing the menopause, sounds like a disease, but it's not a disease. It's a natural process of our body. Unfortunately, sometimes there is some health issues that should be treated, but it's not the common situation. Another interesting point is that the word climacteric and the word menopause is usually applied as the same meaning. They are connected, but they are not the same. Menopause is a milestone of the climacteric phase, and it just means the last menstruation. Well, as I commented before, we searched for official terminology about this domain, and we found the straw stages of reproductive age, not of woman, but W is from workshop. It was a workshop in 2001 that had a second edition 10 years later, and nowadays is considered the gold standard of this subject. It is applied to classify the woman life stage concerning her reproductive period. It is divided mainly in 3 phases: reproductivity, menopausal transition, and post-menopause, and a parallel one called perimenopause. To classify in which, these phases are divided in 10 stages. So we can classify a woman in one of these 10 stages. The classification is done through some criteria. If a woman doesn't manifest any health issue, we just apply the principal criteria. If the woman faces some health issue, we can use supportive criteria, because this kind of issue can affect the menstruation. So we need to know if the menstruation caused the problem or some alteration, or the problem caused some alteration on the menstruation. That's why there are some supportive criteria. I hope that you are searching for the word climacteric. Where is this word here? Climacteric is not a scientific word. So the scientific researchers and professionals are recommended not to apply this term. But it's such a popular term that even the scientific community recommends that doctors, and other professional health use these terms with their patients. But officially, it's not considered. But it's the same on perimenopause. So climacteric, or officially saying perimenopause, marks the last is the period where we have, sorry, it's not seen here, but this line is the last menstruation, the menopause. Well, there are women that face some problem, there are women that face any problem. If we are facing some problem, can vary in intensity and type. If there are some problem, they are called climacteric syndrome. The climacteric syndrome is the set of symptoms a woman can manifest during her age, that is, during the perimenopause or menopausal transition. The symptoms are classified concerning some factors that can be endogenous, physical health stuff, or exogenous, can be mental health stuff, or environmental. Of course, our lifestyle affects our health and our aging. If there are some problems, it should be treated somehow. The type of treatment should be decided together, the patient and the doctor that follow the patient. There are several possibilities that should consider short-term symptoms, for example, the sweat, the hot waves is a very common short-term symptoms, and long-term symptoms. Unfortunately, cardiovascular problem, it's a consequence if you have some tendency to have this kind of problem. And everybody talk about hormone therapy, but this is one possibility of treatment, not the only one. No matter what kind of treatment you are doing, you should use the window of opportunity to start some kind of treatment, and it involves around 10 years after menopause. Well, it was necessary to study the domain, but after studying the domain, we need to decide how to represent it and to disseminate it to the community. So we decided to work on ontology using some ontology engineering process. Considering the ontology, OntoWoH is classified regarding aspects as a reference ontology. In our first moment, we are more worried about conceptual expressiveness. And regarding abstraction levels, we classify OntoWoH as a domain ontology, so a very specific domain, but we want to evolve it, and as we are evolving it, we expect that it acquires some core ontology concepts, as for example, being a person, woman, man, the phases of life that are common of a healthcare domain. So would be somehow a core ontology. And as foundational ontology to guide our modeling decisions, we select UFO, the Unified Foundational Ontology. Just a bit about UFO. UFO is a foundational ontology organized into aspects. UFO A and B, objects and events, are foundational. They give rise to a core ontology called UFO-C that deals with social aspects, but also more direct subjects as UFO-L and UFO-S, also classified as core, legal ontology, service ontology. And foundational ontologies and or core ontology can give rise to domains ontology, as for example, OntoWoH. There are other ontologies as ontogender, the ontology of gender and sexuality, and OntoTB, the ontology of tuberculosis diseases, that is part of our OntoSaúde network that is between a domain ontology and a core ontology in its first steps. Well, UFO is our foundation, and we select, considering ontology engineering situation, to work with the systematic approach for building ontologies approach, the SABiO approach. Here is an image of the tasks and sequence of tasks of this methodology. As we are building a reference ontology, we didn't apply it all the steps yet, but we also have some artifacts, for example, purpose of the ontology, some competence questions, a graphical representation, a complementary textual description, and a glossary of terms. And always concerned with evaluation, we applied some quality control tests, modeling decisions, for example, guided by UFO, verification tests, and validation tests. Well, just to present you the diagrams, I select here two basic competence questions, and I will show the diagrams that we built to answer to these questions. Well, there is no time, so instead of try to show you 15 diagrams, I will show you only 3 of them, starting from the beginning, our main organization, so the overview of the ontology. We are being guided, as I comment, of the phases of human life. So these are our basic package. Every time we want to open a stage, we open a new package, connect to it, and of course, considering the size of the stage, you can organize it in sub-packages. Here we have the climacteric, and here we have the menstrual cycle. Sorry, I will better this. This is the first diagram, the woman's life phase diagram. PowerPoint is tricking us, so I will change our file. I will not use this one. This is just a bit better. I will point here. The first competence question is, what are the woman's life phase, and in the woman specific events, in which phase these events occurs? Here not showing, but here you have the woman concept and the basic life phases to any person: child, adolescence, adult, elderly. During the adolescence of a woman, it occurs the menarche, the first menstruation. During the adult phase occurs the menopause, the last menstruation. The period between menarche and menopause is called menarchema. Menarche and menopause are menstruation. Menstruation is a possible outcome of a menstrual cycle. Another possibility is pregnancy. Pregnancy has basically 2 types: an interrupted pregnancy, and a complete pregnancy. A complete pregnancy results in the childbirth that can result in breastfeeding. An interrupted pregnancy results in an abortion and in a fetal loss. So these diagrams show the common phases of life and specific events of a woman. Let me show the second diagram. It's better to show it. Oh, here is a file showing all the diagrams. I need to show the second diagram. It's better here too. Just a barra preta? Espera. It's here. Let me reduce a bit the zoom. Tem uma setinha ali no canto direito. Not a good idea. How I'm doing a scan. So the second competence question is about what are the stages adopted by the strong terminology. So here we have a concept that represents the system of classification and three phases: pre-menopause, perimenopause, and the last one, not less important, post-menopause. Premenopause is divided in reproductive period and menopausal transition. Each reproductive period starts with menarche, the first menstruation, and here we have menopause that marks is a milestone. Menopause is a milestone of perimenopause or climacteric. Here we can see some divisions of each phase. There is no time to comment details of each of these stages, and a synonym for each of these officials' names that is not so clear. For example, saying stage 4 is not so clear as saying early reproductive period. Let me return to the presentation to end it. So, conclusion, the product we are building is the ontology of OntoWoH that will contemplate all the phases of a woman life. In its first version, I'm dealing with climacteric. We applied UFO guidelines to direct our modeling decisions. We are using SABiO approach to develop a quality process, and we are using visual paradigm with a plugin to OntoML language, that is a modeling language that adopts UFO guidelines to efficiently build the model itself. Some lessons learned. The contact with the domain specialist was the only thing that gave us some confidence that we are building a realistic ontology, because they follow us, they discuss the model, they can read the model, they argue with us, they argue between themselves. There is more than one to do some kind of productive discussion. So we believe that the OntoWoH reflects the reality because they believe in this reflection. UFO guidelines helped us a lot in some modeling decisions, but we believe that we should work better on it. Because of this, we believe our goals were achieved, but of course, there is several next chapters opportunities. For example, OntoWoH is a reference ontology. We want to map it to an operational ontology using, for example, all language. This kind of mapping would help us to access, for example, the OntoWoH founder repository, and of course, to work better in a step that is missing a lot, there is reuse situation. We have some reuse, but to turn easier our life, we used some UFO-based ontology. OntoSaúde, that is the network, and OntoHigh, that is ontology of HIV disease. And of course, the domain itself allow us a lot of expansion. For example, the climacteric syndrome was not explored enough. We didn't detail, for example, all the kinds of treatments, how hormone therapy works, and of course, there are all the other stages that should be contemplated, and connect the woman health ontology to a man health ontology, and so on. So it's just a pilot chapter of a very long novel. Thank you for your attention, and I'm open to discussion.